So we're here at Spinex and we've got Andy from VIMove, and what we're going to do is we're going to put me on the machine to do a little experiment to see what happens during the treatment. So what we're going to look for on this
so essentially
Andy?
What we're trying to see here is how the erector spinae activity is affected using the EMG sensors on the VIMove. So we're trying to establish exactly when the machine is going through, the IDD machine is going through its protocol, what the effect is on the muscle activity, spinal position, so we can relate that to exactly your function, your pain, pre and post IDD treatment.
So we've got the VIMove sensors on my back and we're just going to do a live test now. So cool, thank you. So I'm on the IDD machine and I've got the sensors on my back. The treatment is starting. The tension is going to come on. We've done just under half body weight, so about 90 pounds. We've got a 2-minute progression to the high tension, and then we're going to be looking at the screen, which has got you're on video,
That's me.
And see what happens to the muscles during treatment. We have a live tracking on the screen on the computer, which is for the tension, but the interesting thing is what's going to be happening to the muscles of a patient during treatment. So has just made an observation. We've just started the treatment, and the question is, are we actually going to see anything? So Andy, what were you saying? What are we seeing on the graph?
So on this live training mode here, we can see a representation of what's happening currently in Stephen's pelvis and lumbar spine. And we can see as the pressure is applied to his spine, there's an oscillation, has been oscillating between 8 and 11 degrees, now up to 12, of a lumbar spine flexion. And we can see it, and the machine's doing a bit more now, we can see it on this black line, oscillating up and down to a couple of degrees throughout, even though he's staying completely still. So we're seeing an effect on that lumbar spine through applying the pressure on the IDD machine.
So Andy, so we've got you're saying we're seeing some oscillation. If we on the thing whilst I'm lying here very passive, if we weren't having the stretch, what would you be expecting to see then on the screen?
So I'd expect that black line to be completely flat because there's no active movement of your lumbar spine. So the machine's obviously oscillating your spine to flexion extension, a variation of sort of 2 or 3 degrees as the machine's applying pressure.
Okay.
Let's just have a look at that.
And where you've got those like more pronounced movements, is that what's happening there?
That's, I imagine, as the machine's tensioning you up,
yeah,
or releasing,
yeah,
affecting a greater change.
okay. So one of the things we've been seeing is that as the tension goes back up to the high tension, there's a change in the way that my pelvic tilts. Is that, and what's happening now, Andy?
So it's the oscillation of the lumbar spine. So it's showing, by having the VIMove on there, we're showing that the tension increasing on the IDD machines is targeting the lumbar spine. So when even though you're completely passive, the higher tension goes, the greater the oscillation in that lumbar spine that is occurring, and we can measure that on that VIMove screen there.
Yeah, and even though patients can't feel the oscillation, you can definitely